Ladies and gentlemen, welcome back to the First World Innovation and Benchmarking Summit. Now we're here to kick off the second part of our program, where we will be having a panel discussion about global insights and performance excellence solutions.
May we call on our first member of the panel from Canada. She was the wind beneath the wings of Dale Weeks when he was completing his COVID best practice report. She helped Dale in researching very substantive data from Canada. She is also the principal of Organizational Excellence Specialists Incorporated and board member of Global Benchmarking Network. She has been recognized by her peers with a Fellow Certified Management Consultant designation and with awards such as the Quality and Excellence Builder Award from the Quality Council of Alberta and the Alto Award for Innovative Marketing from Travel Alberta. Friends, let us all welcome Ms. Dawn Ringrose.
Thank you very much for the kind introduction. So if we'll bring up the first slide, I'll begin my presentation. My presentation is all about lessons learned from Canada, and with some mention of the Global Organizational Excellence Index, because the two are really quite intertwined. Now, during my presentation, I'm going to share some lessons learned from Canada during the COVID pandemic, and I'm going to reflect on some challenges that remain and share some insights from the study. And the study is something I've been working on since 2015. Next slide, please. First of all, the COVID best practices. Many of you are familiar with many of these practices that you see on the screen, given the direction of the World Health Organization and our respective government health entities. But there's differences in the way our national governments have operated. In Canada, there are some important characteristics that help manage an unforeseen event such as this. And those things are having respect for data and science, being open and transparent, striving for excellence, and working collaboratively. And one thing that I've really admired about one of our health professionals was the message that she was giving consistently to the citizens during the course of the pandemic. Dr. Bonnie Henry, she's a Canadian physician who is the provincial health officer for British Columbia, where I live. And she used these words to calm everyone. She said, "This is our time to be kind, to be calm, and to be safe." And she said this consistently over and over again. And I think that it's helped people here deal with this global pandemic a little bit better. Next slide, please. The measures that Canada has taken have served the population quite well. And in particular, I live on Vancouver Island, which is the west coast of Canada, and we don't have very much of a population here. So I'm very grateful that we haven't been too terribly affected. We probably see more of an uptick in some of our larger urban centers across the country. And so the measures they've taken have served us quite well. And there's been some very positive impacts when we think about everything slowing down, and positive impacts on the environment with traffic down, pollution down, wildlife sightings up. But I believe there's been some challenges that we have to think about too. And number one, on the social side of things, you hear that suicides are up, anxiety is up. On the economic side of things, there's job losses, business losses. And of course, there's commitment to excellence in the healthcare. Excellence models are much more robust than accreditation criteria. And, I think there'd be some advantages to the health profession taking a look at that and ways they can expand on what they've been doing to date. And I can't help but think that there must be a way to balance the social, the economic, and the health side, and we can do this by thinking creatively and innovatively and using these best practices to our advantage. And I think really, yes, encouraging all organizations to use excellence models, because research over the last 25 years have really validated a formula for success. We found that if you implement the best practices found in an excellence model, that you go on to develop a culture committed to excellence, always striving to get better and better and better, and that you go on to achieve exceptional results across a balanced system of measurement. And I think it would be truly amazing if government, business, and the nonprofit sectors were to use an excellence model. What it really means is that these organizations would have a very good management system in place that would help improve performance and deal with change. Just think about communicating strategic direction well, planning towards it, engaging and involving all the stakeholders in working together towards a common aim, in measuring performance and striving to improve. I mean, these are all good things at the end of the day for organizations. Next slide, please. And in the global study that I've been doing, we've been taking a look around the world at the extent to which organizations are characterized by a culture of excellence and the extent to which they've deployed best management practices that are found in excellence models. And this captured on the screen is a snapshot of some of the findings globally on the extent to which organizations have a culture committed to excellence. We see there's 9 principles here. And if you were really a high-performing organization, you would have scores in the 8 to 10 range. And here we see, though, the results are really quite positive. And we've got 791 respondents so far that have responded to this portion of the study. Good cross-section of organizations by size, industry sector, and country or region of the world. And so we've got a good data set here. And as you can see from the results, the respondents have rated their culture quite positively, with the highest ratings being given to leadership involvement and focus on the customer. But on the flip side, the lowest rated practices are prevention-based process management and data-based decision-making. And when we think about the COVID pandemic, we have to really think hard about these low-rated practices, because when you think about prevention-based process management, that brings to mind things like, how do we determine a cause of death? Is the process going to tell us about the severity of the COVID pandemic? Can the process be improved? And when we think about database decision-making, we have to ask our questions about how does each country gather COVID statistics? Are the statistics reliable and valid? Do the results give us good information on which to base our decisions, such as, locking down economies? Next slide, please. Taking a look at these principles by specific industry sector, we see some of the sectors here on the slide where we had quite a number of responding organizations. And it shows that human health sector has an overall rating on the culture of excellence at 6.5. And it's interesting to see that public administration, which is government, is quite a bit lower at 5.6. And then if we take a closer look behind the scenes at the public administration ratings, we see that they have some of the lowest ratings of any specific industry sector on prevention-based process management and database decision-making. So what these are opportunities for improvement, I mean, it's the whole idea here is to build on strengths, what we're doing well, but to strive towards better performance in those areas where we need to perform a little bit better. Next slide, please. The study has also showed how we're doing in the key management areas. And in each of these areas, of course, are best management practices. And for micro-size organizations with 1 to 25 employees, there's 51 practices, and in larger size organization, there's 102 practices. So these excellence models are very robust, and they really cover the bases. In fact, I've been practicing as a management consultant for 35 years now, and I haven't seen too many issues facing organizations that can't be addressed by using the practices in an excellence model. So they're very powerful. And for this is part of the assessment. We had fewer respondents. We had 238, but they did represent a good cross-section of organizations by size, industry sector, and region. And you might note that the ratings on these key management areas are significantly lower than we saw on the principles. And so this is when organizations take a deeper dive into these best practices, and they really realize, what they're doing, what they're not doing, and see opportunities for improvement. Most of these ratings are kind of in the good start range, which means that organizations are using a reasonable approach. They've got pretty good deployment throughout the organization, good understanding, some results starting. And that it also means, though, that there's this focus on prevention rather than continual improvement. Always asking that question, what are we doing today and how can we do it better? And higher performing organizations have that mindset of continual improvement. So it's really important that we start moving organizations in that direction. Ideally, it would be very good to be moving more towards the 7 range, 7 to 10, because in this range, we know that the management system is more stable, and that employees have got that continual improvement mindset. And of course, people are the most important factor in the entire excellence equation, because they're the ones doing the work, and they're the ones coming up with great ideas and suggestions and innovations on how to do the work that much better. Next slide, please. So this global index really helps us to understand, why some organizations have been more resilient than others during the COVID pandemic. Of special note, really, are some of the lowest rated practices that have included things like developing contingency plans for unforeseen events, conducting a capability gap analysis for resources, encouraging employees to be innovative and take calculated risks, involving customers, suppliers, and partners in designing and analyzing processes, and using external data to compare performance to other organizations. And so these results really show how some organizations are just simply better able to anticipate or respond to age or to change. And so we've seen this in our own environments. We've seen some organizations that have been able to turn on a dime and be more resilient with this pandemic, and others that have stopped, and are thrown up their hands and are in a bad state, And we see that within our governments too. Some of our governments are better able to respond to change than others as well. So the results also reinforce, I think, that we have to do more work to support innovation and benchmarking, and use practices that empower employees and that consider the future and work collaboratively with others. Next slide, please. So as we move forward, we've probably got double the number of respondents on the study now, and we'll be coming out with a new report in the new year. But really, what can we take from this and in dealing with the COVID pandemic and dealing with our organizations now and after the pandemic? Important that we adopt a growth mindset, one that's focused on continual improvement, one that's based on excellence models, using system thinking, one in which we're engaging and involving all of our stakeholders, working towards the common aim, working towards getting better, and that we're comparing to and learning from others, because this is the way we're going to grow and improve and become more resilient. And another very important point is this willingness to collaborate with others. There's things that we need to work on together. We're working together towards a common purpose. For example, how do we better handle this COVID pandemic? And we think about other things that are confronting us, such as global warming and so forth. There's really no choice. I mean, it just seems to make common sense that we have to find ways to collaborate with each other on these sorts of things for mutual benefit, and prioritize these shared goals over and above self-interest. Next slide, please. And when we think about collaboration, I think that people often use this word, but I don't think that they really understand the behavior that goes along with it. And so I wanted to take this opportunity just to spell it out. And this is where we see people that are willing to form trust-based relationships, willing to modify their own processes or systems to maximize the overall effectiveness of collaboration. They're investing in activities that enhance the capabilities of all the collaborative partners. They're engaging in joint business planning and dedicating resources, sharing information and data, monitoring and measuring the impacts. And this is something that I think that is absolutely critical to us going forward. That we are able to embrace this growth mindset full of possibilities and find a way to collaborate so that we can be successful together. And if we do find our way forward in that respect, we'll be that much better at dealing with things like the pandemic and other global issues that confront us. Thank you very much.